In this video we're going to demonstrate how to incorporate Bowen therapy and a massage. I'm getting a lot of questions from massage therapists about, can I do Bowen in a massage? Can I do massage in a Bowen treatment? Can I change up my treatments to do one treatment of massage and the next treatment of Bowen, or vice versa? The answer is yes to all of them. Use Bowen therapy as another tool. And what I'm going to demonstrate today is a whole range of different things that you can use Bowen therapy for. In a massage, to save time, to release particular areas that you might not be able to get to with a massage, or that's not really very beneficial, or not necessarily beneficial, but the ability to go and rub those areas is a bit too personal, let's say. You know, there's areas around the groin which are very important to work, but doing it with traditional massage type strokes would be very invasive. So this is how you can use Bowen therapy very effectively through a whole range of ways in a massage. So I'm going to demonstrate how you could use Bowen therapy in a massage straight off the bat, and it could be the first thing you could do. You could do a whole sequence of Bowen therapy procedures to give you an idea of what's going on in your patient's body, but also to start working. So you're not just palpating, basically you're assessing. So you're getting an idea of tensions on either side of the body, because they'll feel different. And you'll get more and more comfortable with this as you do it, or more and more aware of the tensions you're experiencing on each side of the body. But that's one way that you can already, straight off the bat, incorporate Bowen therapy into a massage. Also, these moves, 1, 2, 3 and 4 are very relaxing in the body. They're 2 relaxation moves. Also think about it as you're releasing the first layer of tension through the superficial back line. So you're already working by doing these Bowen therapy moves and starting to release tension. So it's fantastic how well Bowen can be incorporated into a massage. Okay mate, give me a bunch of nice deep breaths please. Two more. Let your breath go back to normal. So what we can see here right now is that within minutes we will have addressed tension in the legs and started the release of tension in the legs. Because in a minute I'm going to go start massaging the back, and the legs are going to continue to respond and relax, and so are the feet. So instead of the traditional type of massage, you might just be rubbing the back of the body for 15-20 minutes in some cases, and you haven't touched the legs yet. If you do this, the legs can be, halfway there already. So by the time you get to the legs, your work's going to be a hell of a lot easier. So this video isn't about demonstrating massage, it's about demonstrating how to incorporate Bowen therapy into a massage. So I'm not going to be elaborating on the particular massage techniques I'm doing. If you want to learn those with me, then you can go look on my massage website, hoffmanmassage.com. But for now, I'm just going to be demonstrating how to incorporate the two together. So I've treated the back of the body. The legs have been releasing. I did Bowen on them maybe, I don't know, nearly 10 minutes ago now, and they've been relaxing. I just know that's happening from Bowen treatment. Now, let's say that we want to treat the arms a little bit. There's some tension in the shoulders and we're having a bit of trouble releasing it, and through the anatomy trains we can understand that tension in the shoulders is often held in the arms. Also, we've only got an hour to do a treatment, so how are we going to make sure we get all the body covered in that 1 hour? So, you know, you can quickly use some Bowen therapy moves that you've learnt in the diploma course to release the forearms now. Do the other arm. Triceps. Biceps. Lift up the arm. And you can shake your patient about to kind of get them to relax and know that they can be still floppy in this position. And here you can do Bowen moves in the biceps already, just to release these arms. This is more for the tension in the front, but don't think the tension in the front can't affect tension in the back. So what you can be thinking here is tension in the chest can be affecting the tension or the pains or whatever it is in the back of the body. So by releasing the biceps, you're in turn helping release the chest, which can take out some of this tension that you're working on or trying to release up in the back. Just going to go ahead and do this side now. Some other ideas quickly while we're doing this and talking about it is releasing the side of the neck. You can do the side of the neck release moves right here, right now, while the patient's face down, laying prone. And here you're already releasing the side of the neck. If you're good, you can even here be reaching down into the sterno and strumming the sterno. But only do this if you're very comfortable and very gentle with your application of Bowen moves, because you don't want to be making the patient feel like they're choking here. But by all means, this is a fantastic way to already start releasing the front of the neck and in turn bringing more release to the back. What I'm also going to demonstrate now is how to incorporate essential oils into not only this kind of treatment that I'm doing, but also how you can incorporate essential oils into purely a Bowen therapy treatment. So I'm going to go ahead and start and talk about this while I do it. What I'm doing now is basically just applying a thin layer of oil directly on the spine. I'm not doing a massage here, I'm literally just applying a layer of oil onto the spine, or the area of the spine, from the erector spinae up to the neck here. And this is for a protective barrier for some of these oils that I'm about to put on the body. Some of the essential oils that you can use are actually quite heating. That for certain people they can be quite agitating, depending also on what oil. So this is where you get to learn oils. For those oils a bit more. For those of you doing the diploma course, I've added information on essential oils. So learn from these oils, and so this is also going to cover this a little bit for you, but also cover for you how to do a treatment with these essential oils. So what I'm going to do here is now get some oils for my client. I'm going to use a bunch that I feel are going to be relevant for his body type and for the treatment I'm trying to do. He's got a lot of tension there in his back, and it feels quite easy, it feels quite tender, but it also feels quite inflamed to me. So instead of using potentially something that might increase the inflammation or maybe bring more heat to this area, I feel it might be a bit more heat agitated than it is cold, because I can't feel any coldness in his body, so I'm feeling temperatures. So for me it feels like I'd rather put a bit of cooling oils on his body instead of heating ones, and this is where knowing your oils comes into play. So far I've got out lavender. It's a very cooling oil. I'm not going to put that one first though. I'm going to put bergamot on first. I'm in Melbourne here, and it can be quite cold down here, especially in winter. Even though I've got a heater running right now, my room's really warm. It takes a while for the oils to get room temperature. So with bergamot, you could potentially use about 8 drops of oil. You're not going to have to worry so much about contraindications with this oil. So what I would typically do, and I'll show you this just so you can see how someone in a warmer climate might do this, or how I did this when I used to live in Sydney. I'd just drop it on the spine like that. Now, it's not that cold today, and I've had my heater on all day, but if I'd done that in the morning, my first client, it would be freezing and they'd be getting a shock to the system. So that's why I apply it on my fingers first and then rub it on the back. And then once you've done that, you're going to be doing these nice figure 8 moves. What I'm using here is the pads of my fingers, and I'm really just moving around this oil. I'm not doing a massage here. I'm just distributing this oil across the spine and using figure 8 type moves, or an infinity symbol move. You can see you just got goosebumps then. You can get similar responses to what you might from a massage or Bowen therapy treatment. When you do moves around the neck or the scapula, you can get a particular kind of release, and often that's represented by people getting goosebumps. that happened then on his lower back. I'm doing this because he's quite sore in his lower back area and very sensitive to touch. So I want to use some of these essential oils to potentially help relax his body and muscles and help with the treatment. I'm going over here now to get something a little bit more warming, but it's not too warming. It's still cooling and soothing, and this is chamomile. This is one of my favorite oils. This is German blue chamomile, so you can see how blue it was. This is one of my favorite oils, and this is 100% chamomile. So most chamomiles you'll find are 3% chamomile in jojoba oil or some other base oil, and it's usually just 3% chamomile. This one's 100% chamomile, so if you want to get a similar one to that, then try and find a Roman blue, a German blue, or there's other blues, there's Hungarian blue, but yeah, just look for blue chamomile oil and make sure it's 100% oil. It's very expensive, so don't be surprised if it's going to cost you in excess of $50 for something like 7 mil. Also, these figure 8 moves, try and keep them rhythmical. What some people do is make them too fast, and you can be going like this, and then some people might make them really slow, and they're it gets a bit weird almost for the patient. And if you do it in this nice rhythmical motion, it will be typically the nicest thing. Of course, everyone's going to be different, but to what they like, but it's generally a good pace to go. Also note that I'm going from the center of one of the erector spinae group of muscles to the other. I'm not going past it. I'm not going just around the spine. I'm kind of going almost to the center of the erector spinae group. Not going past it really too much. Staying sort of more towards the center of the spine. So now I'm adding some lime. About 3 or 4 drops of lime, spreading it up. I'm going to, in that, add some another drop of lavender or 2. And here I've got an oil called Balance. This is by doTERRA. Very, very nice oil, this one. Grounding blend it's called. So in a Bowen treatment, how I would use this is I might do what I did just in the introduction to this treatment, which was moves 1, 2, 3 and 4, 5 and 6. I might actually do some moves up the back. I might do 7 and 8, so open the spine. I might even then do a whole range of moves on the back. I might release the traps, release the rhomboids, do levator scapula, do infraspinatus and supraspinatus and the deltoid, and I'll do all my moves at the back of the body. Then I'll do this, and then I'll go work the legs with the Bowen, the rest of the Bowen moves in the legs. So then I might do hamstring procedure, I might release the buttocks, I might go all the way and do the feet and do the calves and do the whole lateral line while the oils are on the back of the body and the body's responding to the oils sinking in, but also to the Bowen moves I've done on the back of the body. What you can also do is you can have the Glad Wrap handy, and I don't have any handy at the moment, I just ran out. But what you can do is have Glad Wrap handy if you want, especially if you're using a heating oil, like if you're using chamomile to if you're using cinnamon bark to heat the body. If you're going to use cinnamon bark, only use 1 or 2 drops of cinnamon bark. It's a very hot oil, but if you're going to be using, and you're wanting to kind of keep that oil heating, if you're going to be using a hot oil and you want to keep it heating, use some Glad wrap. And so what you might do is just rip off a bit of Glad wrap, or saran wrap as you call it in America, I think. Rip it off and put it over the body before you put the sheet down. That'll keep the oils from getting absorbed by the sheet and let them continue to absorb into the body. And having that Glad wrap will really help get the heat going for that. Now, also I'm about to start massaging the legs. And so what I could do now, and also we've got a time, let's say we've got a time restriction here. Let's pretend we're really restricted to time and it's only an hour, and I want to get the buttocks because I feel they're important for this person's condition that they've presented to me. But I've also got to massage the back of the legs because they kind of like it and that's what they expect with the massage. So here's where Bowen comes into play really well, with you knowing all these gluteal releases and piriformis release. So we're going to go do a hell of a lot of moves right here. I'm going to do the express buttock release the whole way through on both sides. Now I'm going to do the release of gluteus maximus and gluteus medius, which are the moves close to the iliac crest. Now I'm going to do gluteus minimus release. I'm also going to release piriformis in a more detailed way than just the express buttock release, because why not? Yep, and that was really active on that side. Let's see what's happening here. Yep. And now I've really done a comprehensive treatment on the buttocks, and I can leave that to respond, and that might be all I need to do for the buttocks. So now I can go on to massaging the legs. John's hamstrings are really tight and it's quite difficult for me to work with much pressure because he just can't handle it. It's really, really super tight. So I'm going to do a hamstring procedure to help release these hamstrings a bit more, and then I might go on to do some more work on the feet and come back to the hamstrings. I'll do the other side as well. And let those hamstrings respond while I continue to work further down the body. Here, just throwing in some Bowen moves to Help release the lower leg on the lateral line, on the perineal muscles. And then back to that massaging. So really, you can be incorporating incorporating Bowen therapy into a massage without disturbing the massage, without taking it out of the essence of a massage, that rhythmical relaxation, constant touch of a massage. You can really combine massage and Bowen really well, really effectively, and it will not disturb the massage, like I said, nor will it stop the Bowen therapy actually being effective or having its place in a massage. Now I'm back at the hamstrings, and I can tell you right now that I can feel the difference. And how I can feel the main difference is by how John is responding to my touch. When I was doing a similar pressure, even maybe a bit of a lighter pressure, he wasn't able to stay as relaxed. He was having to take a deep breath already to deal with what was happening, or even his body was twitching a little bit because it was so uncomfortable. So the hamstring procedure really helped me get tension out quickly by doing the move, letting it respond, going somewhere else, coming back later. Now I can work a little bit deeper. Shaking the body is very effective at releasing tension even more. It affects different receptors that only respond to shaking. So this is very effective at releasing these, releasing different muscles and affecting the body in a different way than a rubbing or even a Bowen move. Now what we can see is this hamstring hasn't had any work yet from massage. And I know the right hand side of John's body up there was more tender to touch. Because I've treated John before, I also know his body quite well and know that his right hand side is often more tender than his left. So we can see that I'm able to work this leg at a different level, having done the hamstring release on it, than I would if I just come straight to it with no work on it yet. So the hamstring release has prepared it for me to work a little bit deeper straight away, with leaving that. We probably left about a 7-minute response time by working the other leg or something like that. So from the work we've done so far, now I can feel John much more relaxed through here. He's not as jumpy, it's not as tender, it doesn't hurt him as much. Now here's one example that we can talk about why that maybe combining Bowen with other things can have its shortcomings, is only because you cannot maybe tell exactly if it was the Bowen that did and brought the outcome. Was it the Bowen therapy moves we did on the buttocks that brought release to this? Was it the whole treatments of the legs that did it? Was it the essential oils we put on here that helped relax these muscles? We don't know, but all we know is whatever we did, helped together bring release to these muscles. So it doesn't really matter. But, you know, this is some of the things, I want to cover it all for you. I don't just want to make it to glorify combining Bowen with massage to kind of, you know, make it the complete opposite to the argument that some other people have out there. I want to kind of make you guys understand why that people might say that you can't combine it with anything else. And maybe that's one reason, because even if you combined Bowen therapy with some chiropractic, you might not know if it was the Bowen therapy or the chiropractic that brought the relief of the issue. It's definitely not going to work against it in my experience or opinion. Here I just want to talk about doing Bowen moves when you've just rolled your patient supine and what you might do and how you might be thinking. Again, let's say we've got a time restriction. This person's booked in for an hour. They're complaining mainly about problems with tension in their legs. Let's say John did that. John's a footy player. He's got tight legs from playing footy. And so that's kind of what he's here for today. And however, if you're a practitioner who knows that releasing the neck and head is very beneficial to bringing about relaxation, and you really want to get John more relaxed, let's say, and you wanted to kind of sedate him a little bit more, then working the head and neck can be very good for sedating someone. For one particular reason, it can also be really good for releasing tension in the legs, because if you're thinking about fascial planes, you could release the jaw and release the, let's say, the deep front line, release the inner thigh, release the hips through working the jaw, and you could be aligning a whole lot of things. So without getting into too much detail and just a simple principle, and what I really want to demonstrate more is here is just being able to relax someone and do a quick head treatment that covers the whole head and face even in literally minutes, as opposed to where a neck massage and a face and head massage might take you, 15 minutes. So I'll go ahead and demonstrate that. So here we're releasing the back of the neck. Now doing a release on the sternocleidomastoid. Now we're going to do some work on temporalis. To take some tension out of the head, but also take some tension out of the jaw. Going to do some moves on the forehead now. This can affect the body in many ways, but here you've got the sinuses, so you could be sort of now starting the drainage of the sinuses. Many people you'll notice, being a massage therapist, that they get quite blocked up in the nasal passage from being face down. These moves can very quickly alleviate that, clear the sinuses. Also, now we're still working the superficial back line, because if you know the anatomy trains, you know that these those anatomy trains also have a connection up here. So potentially by working the forehead, you could still be actually working the back of the body and taking tension out of not just that area, but also the scalp and anything down the back of the neck here, or further down the back of the body. Now we're doing masata to release the jaw a bit more. Buccinator. Some more moves to release the face. And another sinus move. And in that, we've done a really comprehensive treatment on the head and neck. So now I can go on to wherever else I feel I may need to work. Now I've been working the quads here with massage techniques, and I've touched a little bit on the RT band, but people can often be so tender in the RT band that it can be hard to work there, especially if they're someone who's just had a workout and they've been doing a lot of squats, or they've been training hard at whatever sport they do. So this is where Bowen therapy can be fantastic to help you with that. So even though there's a bit of oil there, if I wanted to, I could get on the sheet and it would be fine and not slipping at all, but I'm pretty comfortable doing Bowen moves when I've got oil on my fingers, and so I'm going to just release the whole RT band here. With the Bowen move, just to give you the idea of how well you can combine massage and Bowen. There we go, RT band, leave that to respond. And I go on to the next. So let's just say now also you want to release the abdomen a bit. Again, time restriction. Sheesh, I've only got 10 minutes left and this guy's got to go. And this is really important. To me, the belly is probably one of the most important parts of the body, as important as the feet. So what I say to my clients is, when I get to the belly, I say to them, to me, this is the most important part of the body. And because what happens is when I work it, it's often very, very uncomfortable and very tight. And they kind of look at me funny and go, you know, that really hurts. And I'm like, yes, that's because it's not good down there. So I say this is the most important part of the body to me. If I was to work only one area of your body today and give you the best outcome, for me it would be the abdomen or the feet. Through those two areas, you can work miracles basically. But so getting back to, you know, we've got this time restriction and I still want to get the abdomen released, but I really need to do the legs. I'll do rectus abdominis. And that will be more than most people will do on the belly at all in a massage. Most people don't even touch the abdomen. It's so important to touch the abdomen. What I'm thinking when I do this is like, okay, I've got to get there. This person's too tight. I'm going to release their belly, let that respond. I'll start the release of their belly with these Bowen moves. leave it for 10 minutes while I work the legs, come back, and now I can go to the next layer of tension. It will peel back a lot of tension. Back to the ITB, some Bowen moves. Another good way you can use Bowen therapy within a massage is to treat tibialis anterior. In my experience, I've had a lot of people who get Bowen therapy treatments from me and both massage therapy treatments that have never had tibialis anterior addressed in the way that I address it. Even with the Bowen move, they go, whoa, that's tight. I've never had anyone touch that before. So very quickly, you can do this move right here. And that will be very effective at releasing tension in tibialis anterior. And look how quick that was. I'll do both sides in probably under a minute. And now you can get back to whatever you feel your client is waiting for you to do, like their neck. Okay, very much a nice deep breath, mate. Here I'm doing psoas with the Bowen therapy procedure. Other arm. I'm back up to the neck now with some more Bowen moves to see how the previous moves have affected the body, if they've been enough to get the neck to where I want it. Yes, and it is. I'm happy now. I feel that I don't need to be coming back to massage the neck because what I did with those Bowen moves released the neck enough. It will even release or align joints, bones. So if you're good with assessing how the bones are moving in the neck and you do some Bowen moves, you'll very quickly see that it can really bring a range of movement and freedom to, and realignment to bones of the neck. So I'm comfortable and happy with what we've done here. Some further Bowen moves on the pecs to do some more work on the pecs kind of quickly. Now I'm going to show two more moves that are very beneficial for massage therapists to use that are taught by Bowen therapy. I'm going to finish off some of the work I did earlier when I started releasing all the muscles around the face and jaw, and I'm going to finish. They're part of what's called the TMJ procedure, the Bowen therapy procedure. So I've done some of those moves there to now start the release and allow the release of these muscles to continue for the last, I don't know, maybe 20 minutes that I've been working the front of the body. So now when I go do the move on the temporomandibular joint, I know that the muscles in the whole neck and head have already been relaxed, so this move will have a more powerful effect. So another move I'm going to do is called the pelvic procedure, and this is to address the inguinal ligament. What I want to point out here is that if you're a massage therapist and you feel it's important to work this area, most people don't learn how to do this anyway in a massage training. But if you feel it's important, and it's quite a difficult area because it's so close to the groin to be massaging repetitively, and actually quite uncomfortable, and a lot of people will be ticklish around here. So I'm going to show you just quickly how you can do work around here that will really help you release this area of the body with Bowen therapy procedures. So first of all, I'm going to go to the jaw. So John, if I can get you to put your knuckle in your mouth for me, please. Okay, take it out. Wiggle your jaw side to side for me and swallow. I'll just now let your face relax. So that was the final moves of the TMJ procedure, and now I'm going to do some pelvic procedure. Okay, now try not to assist me, keep that leg really floppy. So here we're doing inguinal ligament. Okay, now just allow that leg to be nice and heavy and relaxed. Let your stomach relax. Take your awareness to that hip joint. Let that hip be really disengaged and let all the muscles around that area just fall apart. Same here, mate. Don't assist me. Just nice and heavy. And that's pelvic procedure done. So as a massage therapist, that one is an incredible tool to help people with lower back pain and pelvic issues, and really you can see probably for yourself that you'd have trouble working around here, and there's no way you could have probably thought that you could do a release of all the tension in this area so quickly, but it's very effective and you'll learn a lot from that. You'll learn a lot how the body will respond from very minimal input. So as a massage therapist, as opposed to rubbing an area for 5 or 10 minutes, from learning Bowen therapy, you'll get this understanding that you can actually do a little bit of work in one area. It might be 30 seconds or a minute. Allow it to respond for a while you're working somewhere else. Come back and watch how the body has actually done the releasing for you. So with this, I'll typically finish the treatment. So now allow what's called a wait time, as Bowen therapists will know. Allow a wait time, or what I like to call it, a response time. So I'm allowing the body now to relax, to respond to these moves that I've just done, TMJ and pelvic procedure, for a while. It's really perfect for me to finish this way, because I'll say to my patient, okay, please, I want you to respond to these moves now for a while. I'll let you know when you can get off the table, but then I'll go wash my hands and come back a couple of minutes later and go, okay, you're done, you're ready to hop up now, That's a really good way to finish your treatment with Bowen therapy, because now you're instilling these wait times, so the effectiveness of this treatment is again, improved. But it also is a nice pace for you to use some Bowen moves to keep your patient on the table, because as a lot of you know, some people do want to get off straight away because they've got things to do. So this is a good way to keep people on the table. So with that, that's this video done, and I hope you could learn you learned something from it, and then you can use it in your treatment if you're a massage therapist. So thank you.